I'm often asked by a range of professionals that I work with and consult in healthcare, law, and other professions of how does one unlock your time and become more resourceful and innovative in what we do? Well, the starting point is you need to start thinking like an entrepreneur. You need to start thinking innovatively with an entrepreneurship mindset and always changing your perspective of how healthcare or law or your profession is seen. All too often, it's easy to fall back into the comfort of saying, well, this is how we've always done things. And it's something you hear often, right? But it is the old way of doing things, is the current way of doing things the most effective? And I personally don't think so. Because when we speak for different professions, and I can speak from healthcare coming from that world, is doctors traditionally, and like other professions, are very involved in the aspect of the importance of what they do, and it remains important in terms of their work and our work. But at some point, you need to realize once the work is done, the empathy, the humanity, and the importance of what you do is done, you actually boil down to a line item on somebody's cost center, i.e., your fees and your services for no matter how long you've spent is billed to a patient or a funder who pays for your time. So in effect, as a professional, if you don't adopt an innovative and entrepreneurship mindset, you remain the commodity of your business. You are central to it. You are the most important aspect of what you do. But in reality, you are the commodity of the business. You are selling yourself, your skill, and your time, which is a finite commodity. And it is critically important to appreciate what you know, what you can do, and what your limitations are. But if you want to explore things differently, then you definitely have to start looking through a different lens. And that's through entrepreneurship and innovation. And I'm not saying finding technology solutions and finding new watches and devices, but changing how you perceive where a professional, as a doctor or lawyer or advocate, fits in the bigger picture. And how can you effectively maximize your exposure, maximize your opportunities whilst remaining true to your true cause, whether it be freeing up time to spend with family, freeing up more time to go golfing, freeing up more time to see more patients or clients. Whatever the motivation be, it's about changing that lens of how you see what you do and how you practically do it. Now, that comes back to a primary understanding of entrepreneurship is about looking at the process, looking at the business of what you do. In my perspective, one would say looking at the business of healthcare or the processes and the workflow of how things work. And whilst one needs to appreciate that as an entrepreneur, one also needs to have an accurate understanding of the broader ecosystem or the factors that affect and the push and the pulls of affect what we do. If we speak of healthcare, we need to look at patient flow, healthcare needs, healthcare burdens, factors that affect healthcare, factors that affect access to healthcare, income, economics, then the funders. Who is paying for the patient's care? Will it be the patient and their family? Can they afford to do so? Do they have a medical insurance or a medical aid or a funder or a third party who will fund their services, or are they paid for by the state? Then when it comes to follow-up care, how much time do you have to provide that, or who else in your system or your ecosystem of provision fits in the bigger picture of you being a professional but an entrepreneur at the same time? So one needs to apply their mind and your mind and ours on how do you see these things. And I'm keen to walk this journey with you in sharing some ideas and experiences of how this entrepreneurship mindset is developed, maintained, and continues to remain innovative in this very dynamic and interesting times that we work in.